For 10 seconds, let's step into the world our ancestors understood with absolute clarity. A world where healing wasn't outsourced to laboratories, but drawn straight from the earth, with precision and centuries of trial. Before we begin, make sure you subscribe to Warfield Chronicles so you never miss deeper explorations into the knowledge that shaped civilizations. The old herbal medicine practice that still heals better than some modern remedies starts with the principle that whole plants, used correctly, deliver layered therapeutic effects that isolated compounds can't fully replicate. Historical records from Europe, Africa and Asia consistently show that healers relied on synergy, multiple constituents working together to bring the body back into balance rather than just shutting down symptoms. This wasn't mystical thinking, it was empirical. Generations observed what worked, refined it, and preserved the formulas that proved reliable in real conditions. Using willow bark as an example, traditional healers boiled or chewed the bark to relieve pain and inflammation. Modern aspirin came from studying this exact plant, yet the whole bark contains tannins and flavonoids that reduce digestive irritation, something pure aspirin often aggravates. A survivalist applying this knowledge today can strip fresh bark from young willow branches, dry and store it, then make a simple decoction in the field when pain relief is needed without relying on tablets that may expire or run out. Another enduring practice is the use of crushed aloe leaves for wound care. Historians find aloe listed in Egyptian medical papyri, Greco-Roman military manuals, and medieval pharmacopoeias. Modern gels focus on stabilization and shelf life, but the raw leaf still contains higher concentrations of active polysaccharides that speed tissue repair. Anyone dealing with burns or abrasions in remote settings can harvest a leaf, slice it open, scoop the gel, and apply it directly. The method hasn't changed in thousands of years, because the raw plant still performs better than many processed versions. Fermented garlic preparations also demonstrate the longevity of ancestral healing. In many cultures, garlic wasn't just eaten, it was crushed, mixed with vinegar or honey, and left to ferment. This produced a potent antimicrobial tonic that strengthened the respiratory system. Today, in situations where cold medicine isn't accessible, someone can prepare a small jar of raw crushed garlic and honey, let it ferment a few days, and use a spoonful daily to support immunity. This adheres closely to medieval and early modern practices documented across Europe and the Middle East. Herbal poultices, another ancient technique, remain superior in some cases because they deliver nutrients directly through the skin. Soldiers in the Roman frontier, African pastoralists and East Asian farmers all used mashed plant material, comfrey, plantain, yarrow, to stop bleeding, draw out infection, and accelerate healing. Modern ointments don't always match the speed of a fresh poultice applied immediately after injury. A survivalist today can crush yarrow leaves between their palms, apply the paste to a cut, and wrap it with cloth. It works quickly because the plant's volatile oils and natural astringents are still alive and active. These practices endure because they were field-tested in real hardship, not theoretical trials, and they remain valuable for anyone studying the past or preparing for uncertain environments. Subscribe to Warfield Chronicles and share this guide so more historians and survivalists can keep this knowledge alive.